Hello everyone. In this video we'll share a complete treatment for typhoid fever in Hindi. We'll cover everything from the main medicine to how long it takes to recover. Plus, I'll teach you how to prevent typhoid. So watch this video till the end. Also, I will tell you some very important things about typhoid that your doctor might not tell you. First, let's understand what is typhoid. Typhoid is a type of bacterial infection caused by Salmonella typhi bacteria. This bacteria spreads through contaminated food and water, especially in places with poor sanitation. Once inside the body, these bacteria multiply rapidly and cause an increase in body temperature, weakness, stomach pain, headache, etc. This condition is called typhoid fever. Now we will see the main treatment of typhoid fever. The first and most important treatment is antibiotics. They kill the bacteria causing typhoid. But always remember, do not take antibiotics without a doctor's prescription because wrong or incomplete use of antibiotics can make the bacteria resistant to them. Your doctor will decide which antibiotic you need to take based on the severity of your condition. Some commonly prescribed antibiotics are Ciprofloxacin, levofloxacin, Azithromycin. If your typhoid is severe, then your doctor may inject Ceftriaxone. Generally, doctors prefer to give Ciprofloxacin to adults. It is an antibiotic of the fluorocanoli group, which works by stopping the growth of typhoid bacteria. The dose is 1 tablet of 500 milligrams twice a day for 7 days. But again, your doctor will decide the dose and duration according to your condition. One thing you have to keep in mind is that ciprofloxacin can cause side effects like diarrhea, abdominal pain, dizziness, etc. And it should not be taken with milk or dairy products. Azithromycin is widely used for typhoid treatment. It's a macrolide antibiotic that fights bacteria by stopping their protein synthesis. For typhoid, you will get 500 milligrams tablets, and you will need to take 6 tablets over the course of 3 days. The dose is 2 tablets every 8 hours. While taking azithromycin, you must drink plenty of liquids because it can increase the amount of liquid in your body. In some cases, your doctor may prescribe other antibiotics like Ceftriaxone, which comes in an injection form. This is mainly used when the patient is very ill or has not improved with other antibiotics. Apart from antibiotics, you must take rest during fever. Staying active while having typhoid can make your symptoms worse and delay your recovery. Try to sleep more and eat healthy light food like porridge, soups, ragi, millet, congee, khichdi, steamed vegetables, fruits, curd, etc. Eating nutritious and easily digestible food will help your body fight the infection quickly. During typhoid, there is a loss of water and essential minerals due to fever, sweating, and other symptoms. This can lead to dehydration, making you feel weak and tired. So you must drink enough fluids like water, oars, lemon juice, coconut water, buttermilk, soups, fresh juices. Etc. How much fluid you need depends on your body and the weather. In general, aim to drink at least 2 to 3 liters of fluid daily. You can also consider using a straw to make drinking easier. If your fever is high, Paracetamol will help reduce the fever and body pain. Paracetamol is safe and effective for most people. However, always follow the recommended dose mentioned on the strip or as advised by your doctor or pharmacist. Avoid taking aspirin or any other non-prescribed medicines to reduce fever. In some cases, patients require hospital care. This is mainly when they become severely dehydrated, have low blood pressure, decreased urine output, confusion, and cannot take oral medicines. In such situations, doctors admit the patient to the hospital for 4 fluids or drips. Here, doctors closely monitor their condition and provide necessary treatment. Sometimes doctors may do blood tests to check for complications like bleeding in the gut, etc. In those cases, doctors may give stronger medicines like Ceftriaxone injections, etc. How long does typhoid treatment take? Well, it varies. Mostly doctors prescribe antibiotics for 7 to 14 days. But again, it depends on your response to the medicine and the severity of the infection. Some patients may need to take antibiotics for a longer time. Never stop taking medicine early, even if you feel better before finishing the course. Otherwise, there is a risk of typhoid returning. Once you start feeling better, your doctor may ask you to slowly start eating solid food again. You can start with easily digestible foods like boiled rice, dal chawol, chapati, etc. As you feel better, you can add more nutritious foods to your diet. But remember, focused on eating healthy and nutritious food during recovery. Include vitamin-rich fruits and vegetables in your diet, like oranges, bananas, papaya, spinach, broccoli, etc. These foods will help boost your immunity and aid in faster recovery. Now let's talk about typhoid prevention tips. First, always drink boiled or filtered water. Avoid drinking tapped water, especially if it's from areas with poor sanitation. Use a good filter like a clay pot or a water purifier to remove impurities from the water. Second, wash your hands properly. Always wash your hands with soap and water before eating and after using the toilet, especially after coming back from outside or after gardening, etc. Make sure your nails are clean and trimmed, because dirt under the nails can harbor bacteria. Third, keep food covered. Store cooked food in containers that have tight lids. Also, do not leave food uncovered, especially during the night. Fourth, avoid raw or half-cooked street food. Be cautious when eating out. Make sure the food is cooked well and served hot. Raw or undercooked food can be a source of infection. Fifth, consider the typhoid vaccine. There is a vaccine available to protect against typhoid. Talk to your doctor if you frequently get typhoid infections. Getting vaccinated can reduce the chances of infection and its severity. If you want to know about home remedies for typhoid, then click on this video. Now, I will give you some tips to boost your immunity during recovery, so you can get rid of this infection quickly. 1. Sleep well. Adequate sleep helps your body fight off infections. Aim for 7 to 9 hours of sleep each night. 2. Manage stress. Practice stress-reducing techniques like deep breathing exercises, meditation, yoga, etc. Stress can weaken your immune system. 3. Quit smoking and alcohol. These habits weaken your immune system and slow down your recovery. Do you want me to also give you a diet plan for typhoid recovery in English? Comment below. I will send it to you. Thanks for watching this video. Stay healthy.